This is Dr. Torrey with RookieDoctor.com. It's time for another one of RookieDoctor.com's quick tips for your clinical years of medical school, your internship, and your residency. This time we're going to go over something about hallway conversations about your patients. We've all heard them. And sometimes they're somewhat justified, but this tip is ultra important for your rapport with your patients and just in general the care of your patient. And that is ignore hallway conversations about your patient's attitudes or their family's attitudes or what have you. Ignore them. Don't be a part of them. I'm telling you it time and time and time again. I have been privy to conversations where people say, "Oh, this guy's a jerk," or "This guy's refusing everything," or "He's this," or "He's that," and they're saying all these things, and I go in the room ready for a battle, and the guy's perfectly reasonable. And it happens time and time and time again. Or they say, "Oh, watch out, this lady's a nurse. Be careful. When you go in there, she grills you and she does this and she does this." And you go in and she's perfectly reasonable. Her questions are normal. Her concerns, as somebody a little more informed, are concerns I would have. So ignore these conversations, because here's what happens. This is something that a lot of people don't teach you about rapport, and that is that when you are feeling a certain way, you have nonverbal cues throughout your body that people can pick up on. Sometimes we call it a vibe, sometimes we call it this, we call it that. In hypnosis and in the seduction communities and things like that, they talk about this subject in grave detail, about how your body language and your facial expressions and all these things impact the rapport that you establish with people, right? Well, the same thing goes with you and your patient. And if you're going in ready for a battle, they sense that you're coming in ready for a battle. If you're going in there thinking that these people are unreasonable jerks, you're going to be exuding that. It's going to be in everything. It's going to be in the way you smile. You can detect a sincere smile or an insincere smile. You can detect all of these things, and so can your patients. So if you are part of those conversations and you actually believe them, and then you go into the room, you're going to be exuding other people's opinions. And you've already have an opinion and you haven't even been in there yet. Sometimes all it takes is just listening. Your patients have lost their independence. They are ill. They're not feeling well. They're not going to be the most pleasant people in the world sometimes. And so don't be a part of those conversations. Okay, please. This is an ultra important tip, and it will play out in every patient interaction you have for the rest of your career. So don't start off getting in these little cliques that stand around at the nurse's station and talk about stuff like this. Fortunately, they're few and far between, but when they happen, just don't be a part of it. It's really important. Now, another thing I want to tell you is that if you're on Twitter, you can follow me at RookieDoc. My username is RookieDoc, RookieDoc, RookieDoc. The reason is that I'm telling you to follow me on Twitter is that in addition to letting you know when I make a video like this one, I'll also send out awesome articles, tips, and sometimes some freebies, sometimes things about products, things you might be interested in, links, news in the medical world sometimes that is directly relevant to people in training. So go ahead and follow me on Twitter. If you're not on Twitter, go ahead and sign up for an account and let me be the first one you follow. Okay, so that's twitter.com/rookiedoc.